Hello, ladies and gentlemen. Thank you very much for joining me today on this valuable webinar called Causes and Natural Treatments for Nighttime Urination or Nocturnal Urination. So first, we're going to cover the different causes, which there are, of course, many causes, and only through the diagnosis and understanding of the cause of your frequent urination, your nighttime urination, your inability to hold your urination, or even just the poor flow of your urination. It's very important to know the causes. Now, of course, many people know the cause of their condition when they come to me, but it's not always the case. And then, of course, as per Ayurveda, even if we know the cause, say it's enlarged prostate or it's inflammation of the bladder or the urethra, we still have to diagnose the dosha behind it. Is it vata, pitta, or kapha? So, of course, in Ayurveda, it's not always so simple as here we have a UTI, this is what you take. There's different, doshic imbalances, we could say, to a UTI. One person could have more burning and stinging, while another person could have more lower back pain, while another person could have, a difficulty in the flow of the urine. Well, some people may have no burning at all. So, again, we have to know these symptoms, even though we know the cause, and then we can determine the doshic imbalance behind it and treat it accordingly. So we're going to cover that with the different causes, the different variants, we could say, as per Ayurveda. Then there are some dietary guidelines here, but mostly we're dependent on herbal treatments, which are very effective for this condition. If you go to my website and you look under urinary bladder conditions, you can see I'm full of people thanking me for not urinating any longer at night. I believe that people, particularly elderly women, think it's part of aging. I think this is a misunderstanding and not a very healthy attitude, because it's not part of aging. Yes, of course, an older car can have more health problems than a younger car, but it doesn't mean that an older car can't still run well and cannot be repaired and improved and avoid this particular issue. So I see this a lot with nocturnal urination, where elderly women in particular accept it as part of aging. And then when I treat it, they're very surprised that it goes away. And in fact, it's helped me in getting many referrals, because an elderly woman who is successfully treated with this condition generally refers other people, because people have learned to kind of accept, I wouldn't say learned, but been told to think that it's untreatable or part of aging. Yeah, in fact, people think that, joint pain, muscle pain, urinating at night are all part of aging, but this is false. I mean, you have arthritic pain, you have inflammation in the joints, then, it needs to be treated. I wouldn't accept it as part of aging. And same with, any type of bladder infection or urinary tract infection, or in this case, you would not want to accept it, but you'd want to treat it. And the reason is because that urinating at night is more harmful to your health than most people are aware of. They just think, oh, they're getting up a few times at night. But everybody who's getting up a few times at night is not sleeping very well. And if you research the health issues that result from poor sleep, you'll find that weak, poor development of muscles, poor memory. You don't do very well in school, or remembering things when you didn't sleep well. Cognitive function declines and immunity declines. You become more susceptible to infections and colds and flus. And you often are fatigued in the day, and then you're tempted to have stimulants such as coffee, which only then aggravate the bladder and the urethra and make the condition worse. So this is the cycle that I see a majority of people are on. They're having this excess urination at night. They're not sleeping well. they're fatigued in the day, so they do coffee, and then this coffee keeps them going in the day, which further aggravates the condition and often dries them out because coffee's diuretic and dehydrating qualities, and also stimulates their nervous system and further adversely affects their sleep. Of course, most people say, I just have 1 cup of coffee, but caffeine, just like any type of recreational drug, accumulates in the system. So your 1 cup is accumulating in the system and adversely affecting your nervous system, which is going to affect your sleep. So then the person's sleep is even worse due to the coffee as well. So this is a cycle that I see people in. It's very easy to treat. Usually it's not the main condition that people come to me for. People come to me for diabetes, which also can result in other conditions like neuropathy and nocturnal urination, frequent urination, or people come to me with prostate issues where they're having nighttime urination, or sometimes people come to me with completely different conditions, high blood pressure, just obesity, and I'm aware that they're urinating at night. And sometimes I treat it before I even treat the main condition because it's easier and quicker to treat, and other conditions may take me longer to treat, so I choose to treat the easy conditions first. And this is one that I often pick in the beginning. Other times, people are urinating at night and they have so many other health issues, maybe like poor digestion, constipation, and joint pain, that I have to treat those first before I can get to the frequent urination at night. Often I've done a couple appointments with people, 3 or 4 appointments where I'm treating their arthritis, their joint pain, maybe their liver condition, and this nighttime or nocturnal urination or frequent urination goes away on its own due to the changes in the diet, getting rid of some of the aggravating causes such as coffee, chocolate, stimulants, and other diuretics and such that, and hot spices that could be aggravating the bladder, kidney, urethra pathway. So often the condition does resolve itself. If you're only urinating, say, 1 time at night, then sometimes it will resolve just through treatment of other conditions, because herbs are not like medication where they only address one health issue and then leave you with multiple adverse side effects. One of the most common adverse side effects, of course, is damage to your liver and kidneys. And one of the most common reasons I have people coming to me with kidney failure is due to the long use of medication. And usually they weren't informed about this at the time, but when their kidney starts failing, usually the doctor will let them know that the cause of your kidney failure was your blood pressure medication, which you've been taking for 20 years. And then they come to me. So in those type of cases, of course, you have the cause is the medication. And so the underlying treatment, or initial treatment, has to be to resolve the health condition that requires the person to have the medication first. So that makes it very tricky. So I hope that helped you understand the importance of not urinating at night and not having frequent urination, and to realize that it doesn't generally get better on its own. I've met people, particularly women who are urinating 1 or 2 times at night and don't seem very concerned about it, and then they come back to me in 4 or 5 years and it's 5, 6 times a night. So it seems to go up about 1 time a night every couple years. So if you're urinating 1 or 2 times now, maybe in 3 or 4 years, it'd be 3 or 4 times. And, 10 years, it could be 5 or 6 times. So it does not tend to resolve on its own. So that's another point to note. So let's start with an overall let's cover all of the various causes, first of all, and then we're going to have to isolate our treatment down to the more common causes that we're able to discuss here today. Now, first, most common cause is other medical conditions such as kidney failure. Now, of course, when we talk about kidney failure, there's many different ranges. There's stage 1, stage 2, stage 3. And of course, when you're scheduled for dialysis, this is the stage 4, where your kidneys are failing. And generally, they're measuring your GFR and your creatine as well. So when creatine levels are high, it shows the kidney is failing. That should be less than 1. And, when the kidneys are very failing to a large degree, this number can be as high as 7 or 8. But if the number is only like 1.5, 1.8, then we have a easier case to treat. And yes, I have treated maybe a half dozen cases of kidney failure in the later stages. And it is probably one of the more tricky treatments that takes months. But if you look on my website under kidney conditions, you can see one video testimonial of a woman who was scheduled for dialysis. And the doctor said it was a miracle that her kidneys recovered. I do believe in miracles. And I believe things are in God's hands. But in this case, this woman did do a tremendous amount of work and following the diet for over 6 months, I think 6 to 8 months, and taking herbs daily, 3 or 4 or 5 times a day for this entire 6 to 8 months. So she was a great patient. And unfortunately, with kidney failure, the regime or the protocol is quite rigid because of the diet, because there's many things that can aggravate and make kidneys condition worse, and they have to be eliminated, particularly high protein diet. And so most patients aren't able to stick to the protocol and stick to the plan. So for every 10 clients I have with kidney failure, probably unfortunately only 2 or 3 make it and end up avoiding dialysis. But of course, most people wait until it's very late in the game. They wait until the doctor has them basically scheduled for dialysis. And then, it's serious stage 4. And that's just seems to be the stage that everybody's coming to. But if you're just having a little nocturnal urination now, you possibly could have, very early stage kidney failure. So that's a whole nother subject on its own. I have some webinars on this subject, and there's many causes, of course, of kidney failure. The number one being many types of medication damaging the kidneys over long-term use, and also high protein diet. We do get some young people in their 30s who are weightlifters and bodybuilders having protein powders and steaks and raw eggs every day. And this high protein diet, we can see, creates high levels of urea and uric acid and damages the kidneys. And so a young person can also have kidney failure without taking any medication. But if it wasn't for medication, I think we would see a lot less cases. And of course, if we didn't have people just eating high protein diets, we wouldn't have these as well. Another good reason for not having excessive protein in your diet, an advantage a vegetarian has, because living off of legumes as your main source of protein, it'd be very difficult to have excess protein. I think in the West, we tend to be obsessed with protein. Even people who are big and heavy with good bones and good muscle tone still seem to be always looking for more protein. So kidney failure is one of the major causes. And of course, we have to look at the causes of kidney failure and treat that, which is a separate subject. Of course, diabetes is another cause of excess urination, frequent urination. So if you want to treat this frequent urination, you, just like with kidney failure, you have to treat the underlying cause first. And of course, enlarged prostate for men. Generally, the men will come to me and they're aware that their PSA numbers are high, maybe their GFR, the flow rate, the ability for the urine to flow through the bladder kidney pathway is restricted. So they have these numbers. They know they have enlarged prostate. So to resolve this condition, we have to treat again the underlying cause, which is the enlarged or inflamed prostate. So these are three separate subjects: kidney failure, diabetes, and enlarged prostate. So you'd want to have to focus on treating those individually first before you even got to treating the kidneys. So the area that we're going to mostly focus on is urinary tract infections, urethritis, and cystitis, inflammation of the bladder. This is probably the more common reason for frequent urination, particularly if you've eliminated the other causes like kidney failure or congestive heart failure, or diabetes, or enlarged prostate. If these have been eliminated, and of course with your lab work, you can see your creatine levels and know if your kidneys are failing. You can see the GFR, the flow rate, or how the flow of the urine is through the kidneys and the bladder and the urethra. So if those numbers are good, there's no other indications, then we could have this inflammation in the bladder or the urinary tract. Now, not always the doctor's able to detect inflammation in the bladder or the urinary tract, which of course we know is a type of bacterial infection. So when you have a urinary tract infection, often the doctor is able to detect it, but not always. You could drink a lot of water right before you see the doctor and urine in their cup, and they could do the test, and it still could come out negative, even though you have a urinary tract infection. But I would say the most common reason people have excess urination, particularly women, at night, and frequent urination, is inflammation in the bladder. And that's because it's less easy to detect. They show up negative for a urinary tract infection, and they don't have kidney failure. The numbers are okay there. They don't have high blood sugar. The numbers are okay there. And so then nobody knows what the problem is, because they're not getting a positive test for an infection. But this doesn't always mean that there's not an infection. There can be an infection in the urinary tract or in the bladder, and it can come out as a negative test. So keep that in mind. Now, of course, the symptoms of this type of infection would be even a light fever sometimes at night, burning and stinging when urinating, sometimes a dull ache in the lower abdominal area below the belly button, around the bladder area. These would be the most common symptoms. So this is probably where I'm getting the most testimonials, is from women with this inflammation in the bladder. They don't believe they have a urinary tract infection. They haven't had urinary tract infections. They haven't been taking antibiotics for urinary tract infections, but they still have this symptom of running to the toilet, frequent urination, and nighttime urination. That's probably where I'm getting the most success in that particular case, because people are not able to diagnose it. And the beautiful thing about herbs is that, we could, even though we're not 100% sure that there's inflammation in the bladder, you could take these herbs and there's not going to be any harm. In fact, it's going to improve and tonify your bladder and help you. And I've taken some of these herbs for my urinary tract. Even though I didn't have frequent urination, I just noticed I had not good flow, dripping, and excess urination in my underwear. Nothing serious, but I decided to take the herbs for a while, just like a week. Just 5-6 days. I was drinking one of my kidney support teas, nothing very strong, and I noticed the condition improved within just a couple days. So even if you don't have a serious infection, and there's just like a little flow problem, or the flow is not good, maybe there's some type of blockage. Of course, there's other conditions not covered here today, like kidney stones, tumors that could create blockage. But sometimes we just have a little blockage in the kidneys, and they just need like a little cleanse, a little flushing out. And some of these herbs are doing just that, cleaning the kidneys very gently, because most things do harm the kidneys that are too strong. And this flow can improve. So other symptoms that we could say I could help you with in this type of treatment, or what we're going to talk about today, it's not just infection in the bladder or urinary tract infection, but also just running to the toilet, frequent urination, delayed urination, where you go to the toilet and then it doesn't come out. There's a blockage, and then, or you urinate a little bit and then it doesn't come out to very much, and then you have to go back right away. Or the flow is very poor. For like a man, we can see the flow, and we can see that it's not shooting out against the wall like when we were young boys, but it's, dropping down and dripping, and we just have very poor flow. So this can also be improved with the herbs that we're going to cover here today. And that is the beauty of these herbs, is that they would all help your kidney, bladder, urinary tract pathway, even if you didn't have these conditions, and you could see better flow and eliminate very quickly any urination that you were doing at night, particularly if you were just having one urination at night or getting up early in the morning to urinate and then going back to bed. This could be taken care of very quickly with just maybe even one bag of tea. In fact, I have testimonials where women were urinating up to 10, 15 years every night, and I only gave them one bag of tea for $15. And this condition went away. And they mentioned that in their testimonial, that they were dumbfounded that only one bag of tea could change this condition so easily. So let's talk about a few of the foods that can make this condition worse, and then we'll cover the herbal remedies. Like I mentioned earlier, the first cause of poor kidney function and can lead even to kidney failure is a high protein diet. Now, of course, we know that excess meat and animal protein in general can lead to, particularly like red meat, lamb, and pork, and more so than fish and chicken, has saturated fat, can lead to fatty liver and cholesterol levels, and even excess, fat in the blood, high lipid levels, high cholesterol, and adversely affect your liver, which could ultimately lead to thicker blood, we could say, and even high blood pressure, and even ultimately a stroke. So, having too much fried foods, fried catfish, fried chicken, bacon, bacon fat, this type of high fat diet, much of which is going to come from animal proteins like beef and pork, can also lead to damage to the kidneys because of their high protein content. Of course, high protein can also lead to the growth of cysts, fibroids, and tumors, not necessarily malignant tumors, but just tumors and lumps on the body. When anybody has, excess growths on the body, bone spurs, lumps on their back, or lumps in the breast, or any type of, excess growth on the body, fibroids, cysts, tumors, then you generally want to reduce the protein as well. Again, another good cause, another supportive reason for being on a low protein, I wouldn't say no animal protein diet, but a low protein diet, which would be closer to a vegetarian diet. Fish, we're not going to have the same trouble with. And of course, most of the southern hemisphere is living off of legumes as their main protein source. South America, pinto beans and other beans, and South Asia on dals and mung dals, and even the Middle East on hummus and garbanzo beans and other beans. So, beans still are the main source of protein worldwide, and they are a healthier, better source of protein. So when you have kidney failure, you have to go over to a low protein diet, which means you're having lentils and mung dal instead of your meat and your protein, because you need to lower the protein down. Okay, other things that adversely affect, of course, the kidneys are high sugar levels, as in diabetes. So that's why it's so typical that diabetics, have excess urination because of the high sugar level. So if you don't have diabetes, excess, consumption of sweets. We're not talking fruits here. You're not going to get diabetes from eating apples. We're talking, when we say sweets, we mean cookies, candies, croissants, sugar in your cappuccino, sugar in your coffee. That's what I mean by sweets, not, eating apples every day. Now, I noticed there's kind of become a new fad, or I could say fear, of eating sweets, that people are now afraid of eating even fruit because they're afraid it's sweet. Well, this is just confusion. We should never eliminate an entire food group from our diet, like no grains, no animal protein, and now we're doing no fruit, so that's why, jokingly, I say maybe in the future next we're going to have a no vegetable diet, because this seems to be the trend to eliminate whole food categories. So you don't want to eliminate fruit. That's not going to help your your kidneys and reduce the problem. But having a lot of processed white sugary foods can lead to bacteria growth inside of the kidneys, which then leads to this condition. So you don't want to have a lot of sweets. You don't want to have a high protein diet. And also other things that really adversely affects the kidneys and the bladder and urinary tract, because that's really what we're talking about here. The whole pathway, particularly the sensitive organs of the kidneys, is hot spices. Chili pepper, cayenne pepper, very hot spices can really aggravate this condition. And of course, if you have, a urinary tract infection and you have some chili pepper, you will know what this feels like. It's only going to burn and sting more. And of course, other condition we'd want to avoid if we had any type of excess urination, frequent urination, or nighttime urination, is dehydration. So we see a lot of people not drinking liquids during the day, or having diuretics like coffee and black tea, which are just further drying them out. For every cup of coffee you drink, you probably have to urinate a couple cups. So you're depleting yourself of these minerals, and by urinating so much, and you're taking these diuretics, and you're drying yourself out, your organs out. Now we can see this from dry lips, cracking wrinkles on the face, and particularly, and even a dry, cracking tongue, and of course symptoms, such as poor urination, where there's not very much coming out. It's just little tiny urinations coming out during the day, frequent but small urinations. When what you want is, of course, you want to eliminate the whole bladder. And so you would rather have fewer large urinations throughout the day, none at night, and not little tiny urinations during the day and then a few more at night. That's what we're trying to avoid here. So that's why we are flushing out, cleansing the bladder kidney pathway, killing any bacteria in there, opening up the channels. This is what these herbs are doing. People think, oh, it cured my UTI. Well, that's a allopathic mentality. There's certain herbs in these formulas that clear and open the pathways and get rid of blockages. There's other herbs that fight infection, particularly bacterial infections. There's other herbs that are just supportive of the kidneys and the bladder. And together they work as a team to resolve the health conditions. But one of them on their own is not curing the UTI or curing the nighttime urination. Each herb in a formula has its unique job and unique role, and together they do the job that makes you feel like the condition has been cured. So let's start with some of these herbs. I would say in Ayurveda, the best herb for the kidney urinary tract pathway is gokshura. It's a fruit. This is, of course, organic gokshura. And we have it also in cut and sifted as well. There's some other, I didn't pull it out, parsley, shaved grass, horsetail. There's other ones there as well. And we have it also chopped and sifted gokshura, because gokshura is probably the best herb for the kidney system. And it is a diuretic. it helps with the flow of the urine. And the other good herb in Ayurveda is called Varuna. Varuna. And Varuna helps with the flow, and it's a stronger diuretic, and it opens up blockages in the pathway of the kidney, bladder, urinary tract pathway. In Western herbs, we could look at shaved grass, which is also called horsetail. There we go. Can we see that there? Shaved grass. This is also a diuretic used in kidney support teas in Western herbs. We also have parsley. And we've got a whole basket full. Oh, here's what I was looking for anyway earlier. This is the Gokshura, which is called Tibulus. And I wanted to show it to you because we use it both in our Western formulas and in the Indian formulas. And it is basically a thorn. Yeah, puncture. See, that's a little fruit, tibulus fruit, and that we call in Ayurveda Gokshura. This is the best herb for this condition. So you can see all the formulas I have this. Let's start off with this formula here is a base formula using Western herbs where I added the Gokshura. There we go. Kidney support tea supports weak kidneys, improves function, increases urine flow, and reduces swelling. Of course, swelling in the ankles in particular and the fingers is another symptom and sign of poor urine flow. And I forgot to mention, you could also have, like there's a sphincter valve in the bladder that may not close. And if you have that condition, you urinate when you sneeze. If you sneeze when you urinate, then it's this little valve that doesn't close. So I failed to mention that, and that's a different treatment because the valve is weak and it's it's made of like a muscle tissue. So it's generally a weak tissue, muscle tissue. So we focus on building muscle tissue, strengthening tissue in the body, and at the same time treating the kidney bladder pathway. So back to where I was here. There's the herbs here. See, now the first herb is nettle. Nettle is a diuretic, and then parsley, also nurturing diuretic. There's a horsetail, which when I held it up, the bag said shaved grass on it, or horsetail. And there's the tribulus. See, and I put tribulus / Gokshura. So this is supportive of the kidneys. By itself has resolved many issues. Herba ursi, which is for infection, which is the most famous herb for fighting urinary tract infections. I just put in that formula in a small amount. There's Herba ursi there, cut and sifted. Interesting, the origin was Albania. I didn't know that before. But yeah, these herbs are coming from all over the world. So I just put a little bit of Herba ursi in that formula because with this person, there's no burning, no stinging. They're maybe just urinating one time at night. There's a little swelling in the body, but we have no urinary tract infection, no burning, no pain. That would give us indication that there is an infection, but we'd still put a little Herba ursi in there because Herba ursi does fight this bacterial infection in the kidneys and bladder. And so I think it has worked many, many times for me. I've given that off as a secondary treatment along with other herbs for digestion and pain and inflammation, etc. And sometimes, systemic inflammation can aggravate the kidneys as well, even without, and the bladder as well. You can have like inflammation in the bladder even without having an infection. So I'm often taking a person who has inflammation in their muscles, inflammation in their joints, they're urinating at night. So I'm putting them on an anti-inflammatory diet, giving them anti-inflammatory herbs, the muscle pain, the joint pains coming down. Then I'm giving them the kidney support tea to kind of flush and cleanse out the kidneys, and this problem goes away. Maybe it was never an infection. Maybe it was just inflammation inside of the bladder, and possibly the coffee, the chocolate, the other aggravating foods all in combination. So sometimes we never really know why the treatment was successful, because we changed the diet, we reduced inflammation in the body, we gave the kidney support tea, and ultimately the condition improved. That's why it's very hard to treat these conditions in isolation. You really need to treat a person on a holistic level. I think this is the largest flaw we have in the Western world when it comes to healthcare, is we have a allopathic mentality, which means, okay, what do I take for this condition? And of course, people contact me for nocturnal urination. And I'm sure after this webinar, I'll get contacted by people who say, okay, just send me the tea. I don't want to do an appointment. I'm convinced I want the tea for $15. Just send the tea. And of course, as you know, we don't sell our products without an appointment, because we need to treat the person holistically. We need to diagnose it. We need to come to the causes. And that's why many people who I treat who have 1 or 2 urinations at night, it goes away on its own, because we treated the person holistically. And of course, the main thing that we're doing here to reduce this is reducing inflammation and inflammatory foods in the diet, irritating foods in the diet, changing the diet to get rid of these. Chocolate, cacao is stimulating and aggravating, coffee, dehydration, spices, all these are removed, maybe because of other reasons. And then this urination at night resolves on its own. And of course, like I said, the herbs are very helpful. They don't just treat one aspect of your body, but they're very treating the whole body. When you're drinking this tea or you're taking these herbs, it's not just reducing your inflammation in your joints, but it's reducing inflammation also in your bladder. And if that was the cause, then this condition goes away. So now, if we know that there is an infection there, maybe the person's been on this known cycle of having urinary tract infections, then doing antibiotics, and then killing all the bacteria, trying to take a bunch of probiotics to restore their bacteria, and then a UTI coming again, and then back on the antibiotics and another UTI. And I've heard people go through this cycle for decades, and it's a very unhealthy cycle, because you're getting rid of the UTI so you can get back to work, but then you've destroyed all the healthy bacteria in your body, and you may end up with other adverse conditions, such as constipation, poor digestion, and of course a weak bladder that's able to be infected again easily. So then the infection comes back, and thus you're on this cycle. So in that case, if we know that the person's on this cycle, they're having a UTI, there's a little stinging, there's pain, or there's a history of them, then we'll just do the UTI tea. And you can see it's almost the same herbs. There's the nettle, which is really the base. But now you can see Herba ursi is the second herb. So there's a lot of Herba ursi in here. Maybe there was only 5-7% Herba ursi in the kidney support, but in this one, it's probably 30-40%. And horsetail is still high. It's a diuretic. Juniper berry also fights infection. Now, slippery elm is for that stinging and pain. Slippery elm or marshmallow root could be used. That's just to help with the stinging and burning. And white oak bark is an astringent, good for tightening up tissue and helping with a kind of lazy bladder. And you can see the instructions here. Says take for 7 to 10 days only, not too long. Take a break for a few days and repeat. And it says here, take for only about 5 to 10 days at a time, because they are diuretics and it will dry you out. And when a person is very dehydrated when they first meet me, I may not even give them these herbs in the beginning, because I'm just worried about dehydrating them further. So I encourage them to be sipping warm water, sipping boiled water, having other teas that aren't diuretic, which I often provide, having fruit juices, coconut water, mango juice, and having more soupy foods, no dry foods, no dry crackers, no dry chips. So then I can, by the second appointment, they're hydrated, their lips are not as dry, they're actually urinating more because they have more water in them, and then I can treat the urinary condition. So this is a winner of a product there, that UTI tea. usually some very similar to the just kidney support tea. The only difference being it's going to focus on the bladder and fighting infection in both the urinary tract and the bladder, which is probably the most common cause. Now, if they're stinging and burning and a lot of pain, and sometimes the people don't even test positive for urinary tract infection or infection. And like I said earlier, you could have an infection, a bacterial infection in your bladder, and it's undetectable through test. So we have a special formula here, which we often put inside the kidney support tea if there's very clear case of burning and urgency. And so when we got this burning and heat, we know in Ayurveda this is Pitta. So this is called it's got the Pitta. It's a kidney cleanse formula, reduces the burning urgencies, and they're resolving this nocturnal urination. We take 1 or 2 teaspoons in 8 to 12 ounces of warm water between meals. And there's that Gokshurus tribulus. And the next formula is actually Chandra Prava. Chandra means cooling. And Chandra Prava is Shilajit, Gugulu, and other cooling herbs, because Shilajit and Gugulu are both heating, but they have an unblocking, clearing effect to them. But they're combined with cooling herbs. So it's a very special Ayurvedic formula called Chandra Prava. We often sell it in capsules called clearing tabs, so clearing and opening up. And then sandalwood is cooling, and musta is also cooling. And this is a very sweet cooling formula. And notice it says don't shoot it down after meals in small amounts like most Ayurvedic churnas or powders. It says take it in 8 to 10 ounces of water between meals. This is a very, very important point, because with herbalism, you could have the right herb and take it in the wrong way and it won't work. And this is particularly true for kidney conditions. And I've seen people try to do tinctures, and they're dropping a few drops of herba ursi in some water and drinking it after meals or something. One, there's not enough liquid, because when you're trying to reach the kidney, bladder, urinary tract pathway, you have to do it with water. You can't have the herb or the treatment going with the food, because then it's going to be digested. It's going to go through a different pathway. We have to have it in water. And to get it down to this pathway, this kidney, bladder, urinary tract pathway, we have to take it with a lot of water. And we can't just sip it. You have to get a big 10 to 12 ounces of water and kind of gulp it down. And this will flush it out. So even for this tea, we tell the people, both of these tea, have it in 8 to 12 ounce glasses and gulp it down between meals, and it will make you urinate. It's a diuretic. I mean, it has to get down there to have its effect. So when you have, say, burning, stinging, pain, then we could give you the kidney support tea, tell you to put 1 teaspoon of the Pitta formula, because Pitta it means that, it's burning and painful, and even there could be blood coming out. And so then we would use the same formula, because the blood, the burning, all are signs of Pitta. So this is reducing the Pitta and the heat. And we put 1 teaspoon in a cup of this tea, about 12 ounces, gulp it down once or twice a day between meals. Within a day or two, your burning and stinging would be gone. And it's very, very effective. And very few people have bought more than a couple jars of that formula. Now, if the person talks about a type of blockage, but in the urination system, as we're talking about, this urination system, Mutrabhaya Sutra. I mean, Ayurveda, we're not treating so much disease as we're treating systems and tissue in the body, or we could say organs. And here we're treating Mutrabhaya Sutra. This is the urinary bladder, kidney, urinary tract pathway. That's what we're really treating. And whether you got the infection in the bladder or you got the infection in the urethra, we're still going to give you the UTI tea, because it's going through the same pathway. So if there's a blockage, then the person is unable to urinate. They feel like they need to urinate. They go to the toilet. Not much comes out. There's a lot of dripping. They maybe urinate a little in their underwear, and they have to go back soon. They just went to the toilet and urinated, but wasn't complete. And then, 30 minutes later, they're back again and they didn't even drink any water. So this is a type of blockage, completely different than the case earlier where they're stinging, burning, pain. It's completely different. That's pitta. When there's this blockage, and of course, the person with this burning has probably got a pitta prakriti or pitta body type. And chili pepper is going to make the whole condition worse. Hot spices are going to make it worse. Black pepper is even going to make it worse. Nightshades are going to make it worse. So diet has to change too. But when there's this blockage, then we have this formula here. And of course, this blockage is more of a kapha condition. So we call it kidney support. And there's the K for kapha. It reduces urinary blockages, swelling. So we'll often see a lot more swelling in this case, puppy fingers, swelling in the ankles. There's the Gokshur or tribulus, same as the other one. And there's the Chandraprava, which there it says 26 herbs. Punarava, which is a diuretic and also reducing down and boosting weight loss. Varuna, which we're going to talk about, which is the most powerful diuretic. And Shilajit, which is in Chandraprava, but we're putting a little extra in here because Shilajit is very strong and cutting and clearing and opening pathways, even at a cellular level, but very good for the urinary tract system. In fact, many people take Shilajit for energy and stamina, and it's trace minerals, but it also is very helpful for blockages in the urinary tract. So we put a little bit in there, which makes this a very effective formula. And again, 1 big teaspoon in 8 to 12 ounces of warm water, chugged down between meals, flushed out, and better, we put it right in the kidney tea. A great combination. Very few people need to buy more than 1 jar. Now, if there's a lot of blockage and there's other conditions that create blockages in the this pathway, where if you went to the doctor, your GFR numbers would be low. This is the flow through this pathway. And if this GFR number is lower than 60, I believe the doctors are very concerned. If it gets less than 20, basically your kidneys are failing, and a healthy person should have like over 90% flow rate. But if you have low GFR or you have a certain condition that has a blockage, sometimes people even have cysts or infections inside of this urinary tract that can block this pathway. There are certain diseases. Then we have this formula here, which is like a more powerful formula than the one I just mentioned. And you can see it's very similar. It's for blockages, increases flow. But the difference is there's a lot more Shilajit in here. There's more Chandraprava in here. It's a lot of the similar herbs, just in greater concentration and stronger. So that one has been used effectively. And now, of course, if your creatine levels are high and your kidneys are failing, then, we have this renal cure formula, which is many herbs. There's the Varuna, which we talked about just now, which is the diuretic. Punarava, we mentioned. Gokshura, the best herb. Now, other herbs are less known. Kasni, Buma Malaki, Shirish, Palish, and Moringa, and Ampamarga. So these are less known herbs, and in fact, we only use some of these herbs in this formula. So addressing kidney failure is quite a complex diet and quite a complex cause, but usually we will provide the kidney support tea and the renal cure formula together. And then, of course, there's a very strict diet that has to be followed in this type of case. So there you go. There's always little variations, and sometimes we even custom make these formulas for people to adjust for their condition. So if you have any of these conditions, feel free to contact me. They're not that difficult to treat, with the exception of kidney failure, which takes much longer. However, it is possible. All conditions are treatable, and it's not so much dependent on myself or a very good herbalist with a massive inventory of herbs like myself, but the compliance and discipline of the patient is the most important criteria I've seen for treating kidney failure. But these other conditions, just a little stinging, burning, nighttime urination, excess urination, frequent urination, I would recommend just do appointment and let's take care of it and resolve this condition and move on. Like I said, changing your diet can help, but that tends not to resolve the matter on its own. The herbs are very, very effective when supported by the right diet. Not so much that the diet's going to help this condition, with exception of a few things like taking probiotics, but avoid aggravating the condition. And that's often the case, even with arthritic and joint pain. We're changing the diet not to treat the person, but we're changing the diet so the client doesn't make the condition worse while the herbs are doing the treatment. So it's clearly the case here. We're just eliminating aggravating foods and substances in the diet that would make the condition worse and aggravate the kidneys, burden the kidneys, or if you had an infection, make the infection worse. And then we're depending on and counting on the herbs for doing the work, because God gave us food and medicine, and the food is what tastes good, and everything else, all the other plants, leaves, and bark, that's the medicine. Okay, folks, thank you very much. I hope this helps you out. I hope this helps you realize that your condition is very treatable. Please share the information with other people. I'm happy to help people with this type of nocturnal urination, particularly the undiagnosable type where there's no underlying medical condition such as kidney failure or diabetes or enlarged prostate. Those are also treatable, but they're separate subjects. So again, if you have one of these chronic underlying conditions, then that has to be treated first. And the other reason for kidney failure or even nighttime urination can be medication. So whatever your medication is that's creating this frequent urination, whatever it's for, that condition needs to be treated so that system or organ in the body can recover. You no longer need the medication, and then we removed the cause. So it's very important to accept and realize what is the cause of your nocturnal urination so you can treat it appropriately. Once again, thank you very much, ladies and gentlemen. I wish you the best of health and happiness.